questions.
Okay.
And it's like an edit it if we like make awkward noises.
Oh, I started. So.
And this is just, it's fine, we can edit it. So it's like, we're just doing it on Foreshow's Reddit.
Okay.
So it's just like basic kind of questions, like in your like opinion on it. So it's like,
Is it like easily acquired, like developed?
Yeah, so it kind of comes in two broad categories. So some horses develop arthritis at a young age, and usually those that do have a developmental problem, whereas they were growing from a foal to an adult, they had kind of an abnormal development of the cartilage in the joint, and that's that kind of cushy layer in the joint that separates the bone from the bone. And if that happens, because that cartilage, instead of having a nice smooth surface, oftentimes has kind of a roughened surface, then they develop arthritis because that joint isn't smooth like it should be. So that's one category, and we can see horses that are 2 to 5 to 6 years old, developing arthritis at that kind of age, just because of that. Then you have the other category of horses that typically, because of either how they're built or what they do for a living, develop arthritis, typically as older horses. And when I say older, really not that old. I mean, we start to see it in 8-year-olds and on, on up. And just like with people, the older they get, the more arthritis they get.
Yeah.
So, and there's some horses that, that never get it if they have really great conformation, but most horses will have some degree of arthritis, when they get into their mid-teens.
okay. And then, what's the average cost, like, treatment?
So treatment-wise, you can do, just like if you guys go for a hike or something and your knee bugs you afterwards, you take Advil for a few days. We can do treatment like that on horses where we use almost like an Advil type of thing called bute. And that's really, inexpensive, but all you're doing there is kind of masking the pain. You're not really treating anything that's going on with your arthritis. And that, ends up being, less than $1 a day to treat that way. Then kind of the next step up is if they need medications, usually a lot of the oral medications like we can take, like the glucosamine and stuff that you can buy, over the counter, work somewhat in horses, but not super great. And cost-wise, because of how big they are, it gets kind of expensive, $100 a month, to feed them those supplements. And so what people usually do instead of that is give them medications in the muscle. And those medications basically help to slow down the progression of the arthritis and protect the cartilage that's in there. And treatment-wise, to do that way is about between $300 and $350 every 6 months. And then the most expensive route is for horses that don't respond to that, but yet somebody wants to continue riding them. And a lot of times, it's show horses and that kind of thing, that if they're showing and jumping and doing what they do for a job and they've got some little bit of arthritis, sometimes those other medications aren't strong enough to allow them to continue to do their job. So people will actually, just like, again, they do in people, will actually put medications directly into the joint that has arthritis. And cost-wise for that, for most joints, ends up being about $150 to $200 per joint. And so it depends, most of the time, if they've got arthritis like in one hock, they'll have arthritis in the second hock, so you're kind of treating both. And so most of the time people spend, $400 to $500 to kind of get them feeling better to kind of do their performance thing.
Yeah.
And then, like, how long is the average treatment length?
So the medications that we give in the muscle that I talked about, those last about 6 months. Sometimes people will boost them a little bit early, but you give a series of injections over a period of a month, either once every 4 days or once every 7 days, depending on which medication you're doing, and then you have to redo that at 6 months. The medications that we put directly into the joint depends on what the degree of arthritis that's there, and most horses it'll last somewhere between 4 months and a year.
Okay.
And then, like, the typical rate of success in treatment?
So arthritis, no matter what you do, tends to be something that's progressive. So, what you're trying to do with the treatment is basically make the horse, usable and slow down the progression of what's going on there, but it's going to continue to get worse over time no matter what you do. And so you never cure them of arthritis. You basically allow them, to kind of do their thing. Like I have arthritis in my knees, and if I want to go hiking, I got to take Advil before I do, you know, and that allows me to go do what I want to do, and it's kind of the same thing for them. Most of the time, for most joints in horses, you know, we can treat arthritic joints for at least 3 to 5 years, if not longer, and allow the horse to kind of continue on what they're doing.
Okay.
And then over time, you know, they may end up having to decrease the level of their doing. You know, if they're jumping 3'6" fences, they may have to go down to, you know, 3-foot fences and then down a little bit lower than that. So oftentimes as horses get older and they have some arthritis issues, the owners just kind of decrease their level of exercise as they need to kind of keep the horse comfortable in what they're doing.
Okay. And then what is the common like age range for like the symptoms, like from like really bad to like really good? What's like?
So the ones that have the developmental problems, where they actually have a malformation, you know, from when they're born, we usually start to see problems that way when they're around 8 years old. And definitely by the time they're 5 years old, you'll start to see stuff. If they don't have the developmental issues and it's just, you know, either a conformation or an overuse problem, we usually start to see it as young as 7 to 8. Oftentimes when you're getting up in the 14, 15 range, you know, for sure you'll start to see a little bit of arthritis. And severity-wise, it's really variable because it depends on why they have it in the first place. Do they have it because they injured their leg, you know, and they twisted and tore some of the ligaments or something? You know, something like that's going to have a much worse arthritis than if it's just something that kind of develops slowly over time. So anything that's injury-related tends to be a lot worse and progresses faster.
Okay. And then,
like, what are specific antibiotics given for, like, the treatment?
So we don't antibiotics aren't what we, you know, usually use. The things that we use, one is called hyaluronic acid. And if you've ever heard of that, that's basically the normal joint lubricant. So, you know, one of the main constituents of any joint fluid, you know, if you have a joint like this, there's the cartilage that is separating the bone from bone, but there's also fluid in there to kind of keep things gliding around, because it's almost like, you know, oil in your car. You know, you have to have that lubrication in there for the joints to work. And one of the main parts of that joint fluid is called hyaluronic acid. So one thing that we use to treat joints is to put that lubricant back in, which is the hyaluronic acid. Another thing that we use is one of a couple different kinds of steroids. And steroids are what they most commonly use in people, and basically all that does is decrease the inflammation in the joint. And so you're basically, with the arthritis, there's lots of bad enzymes and things that are produced in there because everything's kind of angry within that joint. And all you're doing with the steroids is basically calming everything down. So it would be like if you've got a really upset stomach and you take Pepto-Bismol to calm it down, you know, it's kind of the same thing. And so those are the most common things that we use as a combination of the hyaluronic acid and the steroid, and we put a little bit of antibiotic in just to keep the horse from getting an infection afterwards, because you're putting needles in a joint, and of course, you know, we scrub the legs, but, you know, because you're working on a horse, it's not like they're the cleanest thing in the world. So something that's been developed more recently in the past probably 5 or 6 years that they are doing in people in Europe, but not doing in the U.S. yet, is something called IRAP. And it's where we take 60 cc's of the horse's blood and mix it with these special beads that has the IRAP in it. And the IRAP is this really long word. It stands for interleukin receptor antagonist protein. Basically what that does is that substance blocks the inflammatory cascade in the joint. So rather than with the steroids, you're kind of masking some of the things that are going on with the joint. With the IRAP, you're actually helping to treat more of the inflammation, and there's less long-term detrimental effects to that. And so, you know, with over time, if you use that first combination that I talked about with the HA and the steroids, sometimes the cartilage continues to progress and get worse because the steroids over time can help make the cartilage degrade. Whereas the IRAP, it actually is only beneficial in the joint. It doesn't have any of the detrimental effects, but it also isn't quite as strong. And so, you know, we try to go that route in the horses, you know, if people will pay for it, it's more expensive, you know, to do it that way, but in the long run, it's better for the horse to do that, if the horse responds to that treatment.
Okay, and then is there any type of like specific like horse breed that is more prone to like getting the arthritis, or like?
Each breed has different areas where they're more prone, honestly, so, and a lot of it is job related. So horses, that work off their hind end a lot, so you think of jumpers, you know, who have to push off over jumps, or, Western horses that do a lot of really tight turns, they're really prone to getting arthritis in their hocks. Other breeds, you know, some of the warm blood breeds that are more doing, you know, kind of gymnastic, massage kind of stuff, you know, are prone to getting arthritis in their hocks and somewhat in their stifles. And so it's really kind of breed and job related more so than anything else. I do a lot of work on Arabians, and Arabians probably because of conformation and because sometimes people start them when they're, you know, a little bit younger than they should, are a little bit more prone to getting arthritis in their ankles, you know, in front than some of the other breeds. So it just kind of depends, and they're, you know, really high-stepping horses, so they put more stress on those joints than, you know, some of the other breeds.
Yeah. Is that all the questions?
Yeah.
Okay.
Good job.